Welcome back, deep divers. Today we're going to be talking about diabetes,
Yeah,
and especially in older adults.
absolutely.
We're using an informational tool from the National Initiative for the Care of the Elderly in Canada.
Yeah, and the reason we're looking at this is over 25% of Canadians 65 and older have diabetes.
That's a lot of people.
It is. It's about 1 in 4.
So let's break this down a little bit. What exactly is diabetes? I feel like it's something, most of us have heard of,
Yeah.
but maybe we don't fully grasp what it is.
It's one of those things, everybody knows the word, but they don't necessarily know what it means. So at its core, diabetes is all about how your body uses glucose, which is sugar.
Okay.
And glucose is fuel for your cells. It's how your cells get energy.
Okay.
But it needs a little help getting in.
Oh, okay.
That's where insulin comes in.
Gotcha.
You could think of insulin like a key that unlocks your cells to let the glucose in.
So when you have diabetes, like you're missing that key.
Well, in type 1 diabetes, that's exactly what happens.
Oh.
It's an autoimmune condition where your body basically attacks the cells that produce insulin.
So it's not something you did or didn't do. It's just your body is...
It's just your body attacking itself.
Oh, wow.
And it's a glitch in the system for sure.
Okay, so that's type 1. What about type 2? That's the one we hear a lot about too.
So in type 2, you have the key. Your body is making insulin,
Okay.
but the lock on your cells is kind of rusty.
Okay.
So the insulin can't really do its job as well, and that's what we call insulin resistance.
Okay, and I'm guessing that's the much more common type of diabetes?
You're absolutely right. It's about 90 to 95% of people with diabetes have type 2.
Wow.
What's interesting is almost everyone with type 2 had pre-diabetes first.
Oh.
You can almost think of that as like a yellow light.
So pre-diabetes, is that kind of like a warning?
It's like, yeah, your blood sugar's creeping up, but it hasn't quite crossed that line into full-blown diabetes.
Okay.
So it's your body saying, hey, maybe we should hit the brakes here and make some changes.
So if you know you have pre-diabetes, is that something you can kind of work to prevent it from becoming...
You can often prevent it from becoming full-blown
Okay.
type 2 diabetes.
Yeah.
There's also gestational diabetes, which happens during pregnancy,
Right.
but usually goes away afterwards.
Okay.
But it does increase your risk of developing type 2 later on, so it's something to be mindful of.
Gotcha. So we have all these different types, and I imagine there's some pretty telltale signs that something's not quite right. I always picture someone who's like really thirsty and having to pee all the time.
Yeah.
Is that accurate?
You're definitely on the right track.
Yeah.
Increased thirst and frequent urination are super common,
Okay.
as well as things like fatigue, blurred vision, and even unexplained weight loss.
And are there some maybe more subtle signs that people may not even realize are connected to diabetes?
Absolutely. Things like slow healing sores or frequent yeast infections can also be indicators. It's amazing how interconnected our bodies are.
Yeah. So the stat that over 25% of people 65 and older have diabetes, that's a big number. Does that mean as you get older, you're automatically going to get diabetes?
Well, not necessarily,
Okay.
but age is definitely a risk factor, especially after 65.
Okay.
Being male also plays a role,
Oh, interesting.
and certain ethnic backgrounds.
Gotcha.
And then there are the lifestyle factors, like being overweight, particularly if you're carrying extra weight around your middle
Oh, okay.
and not getting enough physical activity.
So it's not a guarantee, but it definitely increases your chances. And why is it so important to be aware of this, especially as we get older?
That's a great question. It's because diabetes in older adults is linked to some pretty serious consequences.
Oh, yeah.
We're talking about higher mortality rates, decreased functionality, and even an increased risk of needing to live in a care facility.
Wow, that's definitely some motivation to pay attention. So if someone thinks they might have diabetes, what happens next? How is it diagnosed?
It all comes down to blood sugar tests. And there are a few different types, each giving us a slightly different piece of the puzzle.
Okay, so break it down for us. What are these tests all about?
Well, you got your fasting blood glucose test,
Okay.
which is exactly what it sounds like. You can't eat for at least 8 hours before the test.
Okay.
It gives us a baseline reading of your blood sugar levels.
Mm-hmm.
It's kind of like checking your bank account balance first thing in the morning before any transactions happen.
I like that analogy.
Yeah, and then you've got your random blood glucose test,
Okay.
which can be done at any time, no fasting required.
Oh, okay.
And that gives us a snapshot of what's happening right then. It's like checking your balance in the middle of the day.
So it's just like a quick check-in.
Exactly.
Gotcha.
Then you got the A1C test,
Okay.
and that one's like looking at your bank statement for the past few months.
Oh, interesting.
It shows your average blood sugar level over that time period, so it gives us a bigger picture of how well things are managed.
So these different tests kind of work together to paint a full picture.
Absolutely. Yeah. And then finally, there's the glucose tolerance test.
Okay.
Fast overnight, then you drink a super sugary drink, and your blood sugar is measured at set times over the next few hours.
Oh, wow.
It's like seeing how your body handles a sudden influx of cash, right?
Right.
Does it get deposited smoothly, or does it cause chaos?
Okay, I like that. So all these tests give you different information.
Each one tells us something a little different,
Yeah.
and doctors choose the right ones based on your individual situation.
All right, so we've talked about the types of diabetes, the warning signs, how it's diagnosed. Now let's talk about the scary stuff,
Hmm.
the complications. What are the risks if diabetes isn't managed well?
So there are two main categories.
Okay.
Acute complications, which are things that can happen suddenly,
Gotcha.
and long-term risks that develop over time.
Okay, so what are some of those acute complications?
Well, one serious one is hyperosmolar hyperglycemic state.
Okay.
It mainly affects people with type 2 diabetes, and it happens when blood sugar levels get dangerously high for a prolonged period.
Gotcha.
It can lead to severe dehydration and even confusion.
That sounds really scary.
It can be very serious.
Yeah.
Then there's diabetic ketoacidosis, or DKA,
Okay.
which is more common in type 1 diabetes.
Hmm.
Basically, without enough insulin, your body can't use glucose for energy,
Right.
so it starts breaking down fat instead.
Okay.
And that creates ketones,
Okay.
which build up in your blood and make it acidic.
And that's bad.
And it's very bad. It can cause all sorts of problems.
Okay.
Difficulty breathing, vomiting, even loss of consciousness.
So these are definitely things you want to avoid.
Absolutely.
Okay, so that's the acute complications.
Yeah.
What about those long-term risks? We always hear about diabetes and heart disease being connected.
That's a big one.
Yeah.
Over time, high blood sugar damages your blood vessels and nerves,
Okay.
which increases your risk of cardiovascular problems like heart attacks, strokes, and something called atherosclerosis, which is hardening of the arteries.
So it's not just about your sugar levels, it's about all these other things that it can lead to.
It has ripple effects throughout your whole body.
Wow. And there are other long-term risks too, right?
Yeah, there's neuropathy.
Neuropathy, what's that?
It's nerve damage,
Okay.
and that can cause numbness and tingling in your hands and feet.
Oh, wow.
Problems with digestion, urination, even sexual function.
So this is really serious stuff.
It is. And it increases your risk of other things,
Yeah.
like nephropathy, which is kidney damage,
Oh, gosh.
retinopathy, which can lead to blindness,
Okay.
foot problems, which can sometimes lead to amputations.
Wow, this is a lot to take in.
It's a lot. It also makes you more susceptible to things like skin infections, hearing loss, and even oral health issues.
Okay, so if someone is diagnosed with diabetes, what can they do? What does managing it look like?
That's the million-dollar question, right?
It is.
It can feel really overwhelming at first, but the good news is there's a lot you can do to take control.
Okay, that's good to hear.
You're not alone in this. And actually, our source material explicitly states you can lead a full life with diabetes.
That's really reassuring to hear.
Yeah.
But where do you even start?
Well, one of the most important things is monitoring your blood sugar levels.
Okay.
It's like keeping a close eye on your bank account, right?
Okay.
You want to know what's coming in, what's going out, and make sure you're not overdrawing.
Okay.
And how do you actually do that?
Right.
Well, a lot of people are familiar with those finger prick tests.
Right.
They're still widely used, yeah.
Okay.
It's quick and easy. You just prick your finger with a tiny needle,
Okay.
put a drop of blood on a test strip, and pop it into a glucose meter.
Mm-hmm.
There are also newer devices called continuous glucose monitors, or CGMs.
CGMs, those sound pretty high tech.
They are, yeah.
Yeah.
A CGM is a small sensor that you wear,
Oh, okay.
and it continuously tracks your glucose levels throughout the day and night. So no more pricking your finger multiple times a day.
Nice.
It's like having a mini accountant attached to you, constantly keeping track of your sugar balance.
I like that. So that's monitoring.
Yeah.
What about medication?
Well, medication plays a really crucial role for many people with diabetes.
Okay.
For those with type 1 diabetes, insulin is essential.
Okay.
Their bodies aren't making any insulin on their own.
Right.
So it's literally a lifesaver.
So they inject insulin.
They do, yeah. But the needles are very fine.
Okay.
A lot of people find that they get used to it pretty quickly.
Okay.
There are different types of insulin: rapid acting, short acting, intermediate acting, and long acting.
Oh, wow.
And each type works a little bit differently.
Okay.
And your doctor will help determine the best type
Yeah.
and the right dosage for you. It's kind of like choosing the right financial tool for the job.
Right. Okay.
Sometimes you need a quick infusion of cash. Sometimes you need something that's going to provide steady support over the long term.
Gotcha.
What about people with type 2? Do they need insulin?
Yeah.
Well, some people with type 2 may need insulin as well,
Okay.
but many can manage their condition with oral medications. And these medications work in different ways.
Yeah.
Some help your pancreas produce more insulin,
Okay.
others improve your body's sensitivity to insulin,
Okay.
and some slow down how quickly your body absorbs sugar from food.
So it really is finding the right tool for the person.
Exactly. It's not one size fits all.
Yeah.
And while medication is important, it's only one piece of the puzzle. Diet and exercise are also crucial.
Okay, so let's talk about food. Whenever I hear about diabetes, I think about sugar and what you can and can't eat.
Yeah, it's a common association.
Yeah.
And it's true, you need to be mindful of sugar intake.
Okay.
But managing your diet is really about making healthy choices overall that help stabilize your blood sugar levels.
Okay, so what kind of foods should people be focusing on?
Think of it like building a balanced investment portfolio, right?
Yeah.
You want a mix of different assets
Right.
that will support your overall financial health.
Yeah.
And in this case, your assets are whole grains, fruits, vegetables, and lean protein sources.
So like swapping white bread for whole wheat, loading up on colorful veggies,
Absolute.
choosing grilled chicken over fried.
Exactly.
Okay, that makes sense.
And portion control is also key.
Okay.
It's not about depriving yourself. It's about finding that healthy balance. Enjoy treats in moderation. You wouldn't invest all your money in a single risky stock, right?
Right.
What about exercise? We all know it's good for us,
Yeah.
but why is it important for people with diabetes?
Yeah.
It's actually vital.
Okay.
Physical activity helps your body use insulin more effectively.
Okay.
Think of it like oiling those rusty locks on your cells.
Oh.
So the insulin key can turn more smoothly,
Right.
and it doesn't have to be anything crazy strenuous.
Okay.
Even moderate exercise like brisk walking, swimming, or dancing can make a big difference.
So find things you enjoy doing and do them regularly.
Exactly. Just like creating good financial habits, it's about building those healthy lifestyle habits that you can stick with over time.
I got it.
So it's all about sustainability.
This all makes sense, but even with the medication, the diet, and exercise, I imagine it can still be challenging living with diabetes.
You're right. It can be really demanding.
Yeah.
It requires ongoing attention and effort.
Yeah.
There might be days when your blood sugar is harder to control, you're tired of making healthy choices,
Right.
or you just feel frustrated with the whole process.
It's a lot.
Yeah.
So what do you say to someone who's feeling overwhelmed or discouraged?
Well, first of all, remember, you're not alone.
Yeah.
It's okay to have those feelings. Diabetes is a journey, not a destination.
Right.
There will be ups and downs along the way,
Yeah.
but it's important to focus on progress, not perfection.
Yeah, that's a good point.
And remember that you have a whole team of people in your corner.
Right.
Your doctor, nurses, dietitians, therapists.
Yeah.
They're all there to support you and help you navigate the challenges. So don't be afraid to reach out and ask for help.
That's great advice.
It really is.
So even though diabetes can be tough, it doesn't have to take over your life.
Absolutely not. With the right tools and support, you can absolutely live a full and vibrant life.
And we've talked about a lot today.
We have.
What are some key takeaways you want our listeners to remember as they continue to learn and grow on their diabetes journey?
I think the most important takeaway is knowledge is power.
Yeah.
The more you understand about diabetes, the better equipped you'll be to manage it effectively.
Right.
So don't be afraid to ask questions, do your research, and advocate for your own health.
I love that. What stood out to you from our deep dive today? What are your thoughts?
As we wrap up our deep dive into diabetes today, I'm realizing there's so much to learn. It's easy to feel overwhelmed, especially if you're newly diagnosed or maybe you're caring for someone with diabetes.
It's true. Diabetes can almost feel like a whole new language that you have to learn. But remember, you don't have to become fluent overnight.
Right. Take it one step at a time.
Yeah, just start with the basics, like understanding your type of diabetes, recognizing the symptoms.
And getting comfortable with things like blood sugar monitoring.
Are there any resources you recommend for people who want to dive a little deeper and learn more?
Absolutely. The National Initiative for the Care of the Elderly in Canada, whose information tool we've been discussing today, has tons of great information on their website.
Awesome. We'll make sure to include that link in the show notes for easy access.
Definitely.
Okay.
And another fantastic resource is Diabetes Canada.
Okay.
They offer tons of educational materials, support programs, and advocacy initiatives.
Oh, wow.
They even have a toll-free helpline you can call for personalized advice.
That's so helpful. It's really reassuring to know that there's such a strong network of support out there.
Yeah.
And managing diabetes isn't just about those physical aspects, right?
Like,
You got to take care of your mental health, too.
absolutely. Don't hesitate to reach out to a therapist or counselor if you're feeling stressed, overwhelmed, or anxious about it all.
Yeah.
It's okay to ask for help.
That's such an important point. It's easy to get caught up in like the day-to-day management
Yeah.
and forget about the emotional side of it.
And if you're listening and you're caring for a loved one with diabetes, remember you're not alone either.
Yeah.
There are support groups and online communities where you can connect with others who really understand what you're going through.
Right.
Sharing experiences and tips can make a world of difference.
It's all about building that community of support, right?
Exactly. And diabetes research is constantly evolving. New treatments and management strategies are being developed all the time.
Okay.
There's always reason to be hopeful.
So true. Okay, so to wrap things up, the key takeaway here is diabetes is serious, but it doesn't have to define you.
Absolutely.
With the right knowledge and support, you can absolutely thrive.
That's right.
So keep learning, keep asking questions, and keep advocating for better care and support.
And remember, you got this.
Thanks for joining us on this deep dive into diabetes. Stay curious, fellow deep divers, and we'll catch you on our next adventure.